going to talk to you a wee bit today about the journey I've been on over many years in thinking about health and well-being and success in life generally. And I want to start off by busting a few bubbles. One of the things is that we tend to believe what we read in the newspapers, don't we? And the other thing is we tend to want to oversimplify complex situations. We tend to want to see a cause and an outcome, and the two are intimately related, and it's much more complicated than that. For example, first of all, people are told consistently that Scots are unhealthy. Secondly, we believe that we're unhealthy because of 2 or 3 explanations. We smoke a lot, we drink a lot, we eat lots of fatty foods, and if only we changed all of that, everything would be fine. Well, the fact is only one of those statements is true. But the first statement, which is patently untrue, is that Scots are unhealthy. There is nothing inherently unhealthy about Scotland or the Scots. What this slide shows is life expectancy in 16 Western European countries, and it goes back 160 years. It goes back to 1851. But you see that for most of that time, Scottish life expectancy has been at the middle of the European average. It's only in the past 30 or 40 years that we've drifted to the back of the pack. Something has happened in Scotland over the past few decades that have slowed the rate of growth of life expectancy in our society while the rest of Western Europe has picked up. And if you look at the rate of growth in the richest 20%, the life expectancy in the richest 20%, you can see that the higher up the socioeconomic scale you go, you're actually doing pretty well. You're just about the top of the Western European average. And the rate of growth in the poorest 20% looks like that. They've slowed down a lot more. So that the gap between rich and poor has widened over the past 30 or 40 years, but if it had stayed the same, we would be where we were 100 years ago, in the middle of the Western European pack. What's happened over the past 30 or 40 years is the lower down the social scale you go, the slower the growth in wellness that has occurred in that sector of the population, and that's held the average down, okay? So we need to look a wee bit more as to why that is. But first of all, a few explanations as to why it isn't. It's not because of the facts, okay? Now, don't get me wrong, smoking's very, very bad for you, and if anyone here smokes, stop it at once, all right? But this graph shows smoking rates in 15-year-old teenagers across all the countries of the European region of the World Health Organization, and Scottish teenagers are the 5th lowest smokers in Europe. Scottish men, in a study carried out before the smoking ban came into place, turned out to be the 3rd lowest smokers in Europe, beaten only by Finland and Sweden. The ladies let us chaps down a wee bit, being closer to the European average, but you can see we're not where we are because we have the highest levels of smoking in Western Europe. Nor is it diet. Finland is the country that has done most to change its diet in order to improve health. The yellow line on that graph is the heart disease mortality in men in a number of countries, and the yellow line is Finland. And you can see in the 60s and 70s they had a very high heart disease mortality, and they radically changed their diet. What in fact they did was they took subsidies away from dairy farmers to discourage them from producing fat. Milk, butter, cheese, cream, they took all that out of the diet, thereby making the Finns the most miserable people in Europe. And they gave them the subsidies back if they'd switched to growing fruit and vegetables. And they made free fruit and free salads compulsory in all schools and workplaces. And then they patted themselves on the back because you see the huge fall in heart disease mortality. But next to that yellow line, the pale green line, is the Scottish heart disease mortality. The Finns radically changed their diet. We did absolutely hee-haw to change our diet, and it didn't make any difference. That fall in heart disease mortality has occurred across the whole of the Western world, basically for 2 reasons. First of all, men gave up smoking in huge numbers in the 1960s, and it's been falling ever since. And secondly, the introduction of better forms of treatment Drugs like statins and so on have had a very significant effect on heart disease mortality. So just because you do something and something changes doesn't mean that what you've done has caused the change. In a complex system, lots of other things are happening at the same time. And you need to be very thoughtful about what's causing the change. There's a lot of talk about gap between rich and poor. A book called The Spirit Level came out a while ago that said that it's basically the gap, it's income inequality, the gap between rich and poor that causes a lot of ill health. So we looked at 3 cities in the United Kingdom, Liverpool, Glasgow and Manchester, and looked at their income inequality, and we looked at the causes of death in the 3 cities. And we found that the income inequality was the same in the 3 cities. That's the distribution of income in Liverpool between poor all the way up to rich in small data zones, and that's Glasgow. You can see they're the same, there's no difference there, and Manchester's the same. These are 3 cities with the same gap between rich and poor. But the pattern of ill health, the pattern of death, is different in the 3. And the first thing we noticed was that Glaswegians had a 30% higher premature mortality each year. And this slide shows the 7 causes of death. The dotted blue line is the Liverpool and Manchester standardised mortality rate, and the bars are the mortality rates for Glasgow, okay? And the 2 bars on the left here for cancer and heart disease show that Glaswegians are 12% more likely to die each year from cancer and heart disease, but 60% of the excess premature mortality in Glasgow is due to the 4 causes on the right. And these are, respectively, drugs, alcohol, suicide, and violence. These are psychosocial causes of death. Something has happened in society, something has happened to change the way we think and so on, that have created a society where people are turning to drink, drugs, and fighting, basically. And if you begin to ask yourself, who's being affected by this? Which bit of society has been most damaged by these changes? And this graph, the line at the top here, this is a summary of deaths from just one of those causes of death, alcoholic liver disease. And it's our 16 Western European countries. The line at the top, the jaggy line at the top, is the highest mortality rate any of our 16 Western European countries reached since 1950. And the line at the bottom, the flattish line at the bottom, is the lowest level any of the countries reached. And the thick line in the middle is the average of our 16 Western European countries. And if you put the male liver disease death rate onto that, first bit of it, you can see between 1950 and 1970, Scotland actually had one of the lowest alcoholic liver disease death rates in Western Europe. We think we're a nation of great beviers. Well, no evidence that that was the case in the 50s and 60s. Into the 90s, we're still below average. It's creeping up a bit, but we're still below average in the 1990s, 20 years ago. That's what happened next. That's what happened over a 10, 15-year period. We got the highest death rate from alcoholic liver disease in Western Europe over a 10-year period. And it's come down a wee bit, as you saw in the news recently, but that's because earnings-related price has gone down. The relative cost of alcohol compared to what we earn has gone up. And we know it's very price sensitive. So what we've seen is the emergence of increasing problems associated with these kind of things in the relatively recent past. So which age group in the community is affected by this? Again, the thick line in the bottom is the mean mortality for different age groups. And this is infants. Males, boys under the age of 1, you can see in the 1950s there, we were below average. We've crept up above average a bit. This is boys up to the age of 14. We were very below average in the 1950s, but we're now average. This is young working age men. They're the ones that are being killed. Men between 15 and 44 are being killed by drink and drugs and fighting. And if you compare young working age men with older working age men, they're higher than the Western European average death rates in older working age men, but it's been flat, as has death rates in men above the age of 65. So what we're seeing here is a very, very unusual pattern. It's not as if the whole of society is being affected. It's specifically young, and the pattern's the same in women, okay? Young working age people, people up to the age of 45, in the last 20, 30 years, we've seen the emergence of these kind of problems. So you begin to ask yourself, why? What's happening here? What's going on? And if you think back before 1990, 1980, 1990, West Central Scotland, 5 o'clock any night of the week, 20 miles on either side of the Clyde, the whistles would go and hundreds of thousands of men would fall out the shipyards, or the steelworks, or the locomotive works, and in Dundee it would be the jute mills and so on. They had jobs, and they had jobs that gave their lives meaning and purpose. Okay, these were significant jobs. They weren't, they were dangerous and cold and all that kind of thing, but men felt good because they built great ships. It was iconic. It was who you are if you were a welder in the shipyards. And then that disappeared. And at the same time as the jobs disappeared, things were happening to community because we decided to improve the houses. The housing that we had particularly in Glasgow, this is a picture of a Gorbal street from the 19th century. The thing that strikes you here is the people. There's a community there. The kids are out playing, the adults are out talking and all that kind of stuff. There's an interaction going on. Bridgeton Cross, the early part of the 20th century, a space where people would gather and meet. And the critical thing there was the social support. If a young mother in a tenement was struggling, the old woman up the close would come and help her. They were there to sort things out. And then, of course, we improved the houses. We broke up communities that were cohesive. And we put people 20 stories up in the sky, and friends that they'd had for 20 years they never saw again because they were decanted elsewhere. So the combination of disintegration of community, loss of iconic work and so on that defined who a person was, suddenly left space in people's lives, and they filled that space with drink, drugs, and fighting. So we began, when this all began to formulate in my head, I thought, okay, what are the theories that would describe how these kind of social pressures related to health? And there are a couple of dozen theories in the literature that have been grouped under this heading salutogenesis. Pathogenesis is a word that means the causes of disease. And doctors are obsessed with the causes of disease. What I want to get them thinking about are the causes of health, salutogenesis. And there are about 25 different theories on that slide that you could say describe how we create health for ourselves. But I'll just describe one of them in some detail because this guy's theories pointed the way to us to think and work out how actually our social circumstances actually cause the molecules and so on in our bodies to create disease. And spend a wee bit of time talking about him. He's an American sociologist who spent most of his life in Israel studying the health of adults who had been as children had been in concentration camps. And what he found was that about 70% of them were unhealthy. Physically unhealthy, mentally unhealthy, socially they were failures. They lacked this wellness that I'm talking about across all dimensions of life. The question he asked himself was, why aren't they all unhealthy? What protected the 30% when the 70% were being damaged? And what he concluded was that the thing that protected them was that as children, before they experienced the concentration camps, they had acquired a particular psychological outlook. And he described that psychological outlook as having a sense of coherence. And a sense of coherence consists basically of three things. First of all, a sense that the world out there is structured and predictable. We can see the events round about us. We know what's happening. We know, some of them are good, some of them are bad, some of them have implications for us, lots of them don't. But we understand what's happening, and we think we can manage what's happening. When bad things happen, we sit down and we think, well, how am I going to get myself out of this? And we have the confidence that we're resilient enough to get ourselves out of it, that we have the internal resources required to meet the demands posed on us. And the third thing that he said was, we saw the events round about us as challenges that we wanted to overcome. And he went on to say that unless we saw the environment round about us as those three things, structured and comprehensible, manageable and controllable, and meaningful, we would experience a state of chronic stress. Now, at the time, I was a surgeon, and my job was to create acute stress in people. That's what a surgeon does. The stress response, the body's stress response, is actually the physiology that kicks into place to defend us when we're threatened. When you get damaged, if you break a bone, if you get a cold, if something attacks your body, the stress response kicks in, a whole range of hormones start to flood into the bloodstream and proteins and so on that are involved with healing. And after a surgical operation, your body's awash with these things, but within a couple of weeks it comes back to normal because you've healed or you're healing. When I read that, I remember reading that and I remember sitting up bolt right thinking, wow, this is really interesting, because it had never occurred to me that you could switch on the stress response and it would be on for 40 years. And in fact, the evidence is that it damages you. This is babies. Babies who are looked after in orphanages. Their stress response, as measured by this hormone cortisol, goes up consistently. There's something very stressful to a baby. No matter how good the orphanage care is, looked after children are stressed by not having a consistent adult to interact with. And the evidence is that that's turned on permanently. This is data from an occupational hierarchy. It's the civil service. And it's daytime cortisol profiles of 30,000 civil servants. Your cortisol levels, your stress hormone levels are always highest in the morning and they go down during the day. And you can see here that lower grade civil servants throughout the day have higher stress levels than higher grade civil servants. The bosses are less stressed than the frontline workers, actually. Why is that? Because the bosses are in control. Control is really important. Martin Bobak, a colleague in London, went round the countries of the former Soviet bloc 10 years after the fall of the Berlin Wall. And along the bottom of that graph are results of a questionnaire he gave hundreds of people in each country as to how much control they felt they had over their lives. And up here's death rate. Russia, in the top left-hand corner, citizens of Russia had the lowest level of control. They had the highest death rate, all the way down to the Poles and Czechs. High levels of control, low death rate. The most deprived parts of Scotland are about the middle of that graph, up near Latvia and Estonia. If you're struggling with the bedroom tax and you're struggling with social workers that are maybe talking about taking your kids away and you're worried about paying your debts and all that kind of stuff, the payday loans and so on, people are doing things to you. You're not in control. And it's no surprise that you're somewhere to the left of that graph. Another really important study was this study carried out by a woman called Susan Everson, an American lady who went to Finland to study the health of these men at high risk of heart disease. And she measured everything you could think of, including hopelessness. And she had a questionnaire that split men into three groups. Men who were very, very hopeless, men who were moderately hopeless, and men who were just a wee bit hopeless, because she was a woman and she understood that all men are hopeless to a greater or lesser degree, okay? But what she found was that men who scored highest for hopelessness were 4 times more likely to die of heart disease and 2.5 times more likely to die of cancer than men who were more positive about the future. And she couldn't explain that by the drink or the tobacco or anything. Statistically, she was able to show that hopelessness was an independent predictor of death from these causes. It wasn't suicide or anything, it was heart disease and cancer. And she did a really interesting thing. She measured the thickness of their arteries. She's measuring here the thickness of the artery in the neck, the big artery that goes up the side of your neck to supply the brain. This guy's lying on his back, his head's to the left, his shoulders to the right, and you can see at the back of that artery, this is the main artery where it says ICA, that's the internal carotid artery, and it's going up to supply the brain. And you can see at the back wall there's a plaque of fat sitting there. That's cholesterol. And she showed that over a 6-year period, the fat thickened in the men who were most highly hopeless, the most negative men. They thickened their arteries faster. And she said, well, if you're negative about the future, if you feel pressured and people are messing you about and you're got no sense of control over your life, you will be stressed. Cortisol, the function of cortisol is to mobilize fat in the bloodstream, to give you energy to run away from saber-toothed tigers. That's why we've got it. And what she was saying was, how many extra molecules of cortisol would you need to secrete a day in order to thicken your arteries by about 1 millimeter of fat over a 40-year period? She said, probably not that many. So there was a link between the psychological stresses that made you feel negative about the world and arteries being thickened. And we began to measure other things. This thing that we measured here, 5,000 west of Scotland men, this substance called C-reactive protein is a sign of how much inflammation you've got in your body. The lower down the social scale you go, you double the levels of cortisol. If you smoke, you double it again, and if you're obese, you double it again. Fat smokers from poor areas are have 8 times higher C-reactive protein levels than skinny non-smokers from affluent areas. And the significance of that is it's the inflammatory process that ruptures your arteries. The cortisol here, the yellow stuff in this diagram, is the cholesterol, and the cells lining it on the inside of the artery are like Teflon. But if you switch on the inflammatory response, those cells get damaged, they rupture, and when they rupture, a clot forms on top of the ruptured bit of artery. So here we're beginning to see, actually, stress, long-term stress like that, driven by social circumstances, there's a mechanism by which you can begin to see heart attacks and strokes taking place. But we still weren't able to explain why it was you got, even babies got switched on stress responses. What was happening? What was it that does it? And we now know the explanation, and it's an astonishing explanation, actually. And the best way I've got of describing it is to describe to you an experiment I saw in the psychology department of a New York university. The experiment they did was they made baby monkeys depressed, okay? And the way they made the baby monkeys depressed was all down to the way they let the mothers feed the babies. One half of the animal house, mum had free access to food. She's playing with the baby, baby's hungry, she walks 2 yards, picks up the food, gives it to the baby. The other half of the animal house, they make it hard for mum to feed the baby. They take the food away and a long distance away. They put it in an inaccessible place, so the mum has to go and find it. She's away from the baby for longer. She has to fight with other mums to get it, so she's hassled. And this is the point where I begin to recognise who the working mums are, because they start to feel a bit guilty. They think, oh no, what's he going to say next? Because you naturally assume that it's the babies of the mothers that are away a lot that get stressed, don't you? Well, you'd be wrong. Because, and this is the thing, you've always got to look behind, never take anything for granted. The green triangles there are the stress hormone levels in the babies where mums finds it easy to feed them. The yellow triangles are the stress levels in the babies where mum finds it hard to feed them, and they're the same. The red triangles, however, are the stress levels in the babies where they randomly change the feeding pattern from one day to the next. It's not mum being there or mum not being there. It's not knowing. It's inconsistency. It's uncertainty that stresses the baby. And the researchers began to look for explanations as to why that should be the case. And they found that brain structure develops differently in stressed babies compared to babies who are nurtured normally. The three areas that are involved are prefrontal cortex. This is the bit of the brain that allows you to see the world as structured and predictable. It allows you to take in new information and integrate it into things and understand what's going on and act appropriately. The cells don't develop in stressed babies to the same degree as they do in unstressed babies. The hippocampus is the bit of the brain that's involved in memory. It integrates short and long-term memory. Patients with Alzheimer's have very shrunken, small hippocampal volumes. And it doesn't develop in these babies, so these children grow up to struggle a bit at school, less able to remember things. But critically, the hippocampus is the bit of the brain that allows you to suppress your stress response. It has cortisol receptors inside the cells. And when these cells encounter cortisol, they send messages all the way down the spinal cord to the adrenals to switch off cortisol production. So stressed babies don't produce that mechanism, which explains the chronic elevation in the stress response. And the other bit of the brain that changes is the amygdala. That's the bit of the brain that lights up when you're emotionally aroused. So these young animals are more aggressive, they're more fearful, they're more unpredictable. So we took some volunteers to the Southern General and scanned their brains. So what happens? Hippocampal volumes are smaller the lower down the social scale you go. Cell integrity is poorer. We used a very complicated technique called MR spectroscopy, which I don't understand, and showed that the cells aren't working so well. This is what's out there, okay? And we think that the mechanism by which inconsistency leads to this differential pattern of brain growth is down to the attachment process. The attachment process is the way a baby reacts to external events. When it feels hungry, it cries, so that's the serve, and mum puts a return into the system. So baby feels hungry, he cries, mum will pick him up, cuddle him, talk to him, feed him, stress resolved. By the time that process, that sort of tennis match has taken place 500, 1,000 times, the brain cells are growing in a definable pattern because baby is seeing the world is structured and predictable. Whenever something's wrong, all he has to do is the crying thing. This daft person comes along and fixes it for him. So the world is structured and predictable, and he's in control. I just do that, and it happens. Whoa. Easy street. That's men all over, isn't it? Contrast that to the experience of a baby who, when he cries, sometimes gets fed, but sometimes doesn't because mum's drunk or under the influence of heroin. And even worse, mum's partner picks baby up and shakes him and slaps him and so on. That baby's learning that the world is not structured and predictable. He has no control over events, and it's dangerous. And all the things I've described to you here are the upregulation of the defense mechanisms. The cortisol that allows you to run away, the emotional ability that allows you to be alert for saber-toothed tigers leaping out at you. This is an evolutionary thing. And it's real, it's out there because we've measured it. And it's not just West Central Scotland that this is the case. Every group that has looked at this over a long period has seen the same kind of relationships. The Adverse Childhood Event Study was carried out in middle-class Californians. They looked at the incidence of 9 different types of adverse event in a child's life, of different types of abuse, neglect, parental absence, and so on. And what they found was that the more adverse events in a child's life, the higher the risk of an adverse outcome. For example, 4 or more adverse events meant you were almost 8 times more likely to become an alcoholic than a child who had no adverse events in their life. 4 times more likely to become a heroin addict. Boys who experienced physical violence were 8 times more likely to grow up to beat up their partners. 4 times more likely to be arrested for carrying weapons. Drugs alcohol, violence, suicide. Has what's happened in West Central Scotland following the kind of disintegration of a coherent society in the 70s and 80s meant that children of that period have grown up with a higher risk of adverse events, and in turn, as they have become parents, their children are experiencing adverse events, and we're seeing this gradual widening with the emergence of these conditions in the 40-year-olds that we never really saw before. That's a very likely explanation. And the increased risk of heart disease. The more adverse events in early childhood, the more likely you are to have early diagnosis of heart disease, type 2 diabetes, and so on. This is the molecular biology of a cuddle, okay? Whenever any of us feel happy, we release from the nerve endings in our brain a chemical called 5-hydroxytryptamine. The 5-HT circulates in the bloodstream. It gets picked up by a transport mechanism in the cell wall. That's chromosome number 5. There's a gene in chromosome number 5 that whenever it binds to 5-HT is activated. That's the gene that codes for the cortisol receptor. Neglected children who don't release a lot of 5-HT don't switch on the gene and produce the cortisol receptor. So here you've got a chain of events that links social circumstances, lack of connectivity, lack of love, lack of care, to increased risk of psychological and physical ill health in later life. So this business about creating wellness, if we take that all together, and we assume that Antonovsky is probably pretty close to the truth, what he's saying is that the way we create wellness is by giving people the capacity to feel in control of their lives. And that sense of being in control means that whenever events stress you, you feel able to resolve them, and that enhances your sense of well-being. And that sense of coherence is what allows you to feel in control of your life. But Antonovsky recognized that throughout life we would encounter events that were beyond our ability to manage. You know, we all encounter things, oh God, what am I going to do about X or Y or whatever? And what he said was that we need access to external resources that support us at those times. Those external resources could be a nurturing and supportive family. They could be the confidence that comes from having done well at school and got qualifications and be in a job. The confidence that comes from having a level of material resource behind us. Or the support that comes from a community. Sense of stability, a sense of cultural roots and so on. A stable set of answers, being a member of a church or having a philosophy to guide you. All of these things, he said, were important. And the problem, as I perceive it, is that historically what we've always done is we've always tried to fix one thing. We've been through the phase of saying, this is all about cigarettes, so let's try and persuade people to stop smoking. And now we're in the phase of saying, this is all about poverty, let's just give people money. You have to do all of these things. People need the support of a community as well as these other more practical helps. And a couple of years ago, we had a visit from a professor of public health in Australia. We sat down with him on this and he said, this makes a lot of sense to me. This is what we see in the Aborigines. This is what we see in a community that has become dislocated from traditional ways of living. They've lost their anchors and they're just drifting. And they fill up the space in their lives with drink, drugs, and fighting. Certainly looks the way here. There's a kind of alienation. I think the problem is alienation. People talk about poverty, fix poverty and it'll be okay. Actually, across the life course, people become alienated. Babies who aren't nurtured don't attach, don't learn how to attach. They don't behave well at school. And what do we do when they don't behave well at school? We exclude them from school. Precisely the wrong thing to do. At a time when we should be sweeping them up and supporting them, excluded from school. And I spent a lot of time in Polmont and Carstairs and so on. And the story is, they banned me from school. So just 7-year-olds, 8-year-olds going out finding drink. 10-year-olds, they're on drugs as well. That's what happens when you exclude people. And that process alienates them even further. They go to jail. The 17-year-olds in Parliament think their lives are finished. What are you going to do when you get out? Nobody's going to give me a job, a conviction, disclosure certificate. So what will you do? Well, I'll sit in the house and I'll watch telly and I'll drink. 17. We've alienated them and we're pushing them away. And there's a cycle here where chaotic early years lead to these poor outcomes in health and education and offending, lead to worklessness and poverty and further alienation. The challenge, therefore, is to bring them in. Inclusion is the solution to the problem of alienation. And connectedness. We've found about 150 different publications in the literature that have studied 300,000 people and measured their social connectedness. People who have rich patterns of social connection are almost twice as likely to be alive at the end of the study as people who have no good social connections. And our public services do things to people, not with people. The public services have been set up to fill the gaps and fix people's problems, and that's precisely the wrong thing to do. The public services should be there to help people fix their own problems, to be in control, to take control. And therefore, we've been talking about assets, finding out those things that sit within people and their immediate surroundings that help them buffer themselves against the stresses and events of life. Think of the positives, not the negatives. Don't do things to people, do things with people to help them create a sense of community and connectedness within themselves. So we've started doing this. That's just the other thing. We talk about this. I mean, in public health, people have this thing that poverty causes health inequalities, and the only way to fix health inequalities is to redistribute wealth and to redistribute power within our society. Aye, very good. Next Wednesday we'll do that then, eh? You know, does anyone think Mrs. Merkel's going to let that happen anytime soon? So we've got to find a way of fixing it now. What can we do now to start changing things in a practical way? And we've started with the children. Early Years Collaborative, which some of you may have been involved with, that is beginning to transform early life from -9 months to 8. What can we do? What can all of us do that can help nurture children whose parents find it difficult to do that? Make Scotland's hospitals safe as we can. We've done a patient safety programme, reduce offending. Scottish Prison Service and the Governor of Parliament are absolutely adamant that they want to transform life for these young men and find ways of doing it, and they've started that process. Reduce dependence in the elderly. Make 60 the new 40 is not nearly ambitious enough, okay? So we're going to make 70 the new 40. We've got to do this across the life course, and we've got a method for doing it. And it all starts with the way in which you involve people. The classic way which any government does things is this. You decide you're going to do something, you get the great and the good into a committee room, you get a civil servant to take the minutes, they meet once every couple of months, they read the minutes, they make pronouncements. At the end of it, a paper goes to the minister who approves it, and the civil service writes an implementation plan, and nothing happens, okay? Nothing changes, because they're miles away from where the action needs to take place. People aren't going to be committed to something that they haven't been involved with. So the Early Years Collaborative works this way. What we did was we designed who was going to get to the collaborative. And then they all come into a room, everyone involved across 32 local authorities in Scotland get into a big room, and they decide what they're going to do, and then they go home and they do it. And if it works, they do more of it. And if it works, they do more of it. And if it still works, they tell everyone. So that you've got this continual cycle of change and doing things. And this is what the Early Years Collaborative room looks like. 800 people. That guy at the front there is Sir Peter Housden, the permanent secretary. He comes to Early Years Collaborative. John Swinney came to give a 20-minute speech, and he stayed for 5 hours, and he was blown away by what he saw in here, because it was the people who deliver the service who were designing what they were going to do. And they were telling everyone, yeah, the last time we tried this, that worked, but that didn't, so we stopped it. And what we're seeing is a method that is changing practical delivery of things on the ground. You break things up into what your aim is, reduce infant mortality. What are the drivers of infant mortality? What are the things we can do in our wee bit of Scotland that will change things? We're seeing 10 mothers tomorrow. What can we tell them that will allow them to reduce their chances of their child dying within the first year of life? So it's about smoking, it's about drinking, and we measure it. We saw 10 women yesterday, 8 of them smoked. We gave all 8 smoking cessation, so we'll see them back next week and we'll see if it's working. And if it's not working, we'll do something else. And it's that level of detail. We don't do it and wait for a year to evaluate it. We evaluate it today. And if it's working, we'll do more of it tomorrow. This, for example, someone sat in my office in Edinburgh and said, oh yeah, this is all very well, but it'll take you ages to see if it's working. I said, well, I can take you down to the Grassmarket nursery now, and they'll tell me how many of their kids got a bedtime story last night, and the night before, and the night before. Because this is one way of enhancing children's connectedness and so on. So they're all doing this, and what they do is they follow up, and they see what are the things that cause dips in it, and then they share it. There's another nursery that's picked up Grassmarket stuff, and they do things, and they know from one day to the next how successful they are. So it's this very practical application of stuff. And I'll just finish with a couple of quotes. This guy transformed violence in South Los Angeles. He was a priest, sent to a practice, a parish, and the police told him he would be dead within a week, because that's what they did down there. And he said, well, okay, that's what I'm here for anyway, that's what we do. And he came to Glasgow recently at the invitation of the Violence Reduction Unit. And I had the privilege of taking him to visit a school, and he told me that the thing that changed South Los Angeles Latino gangs was connectedness. He went and spoke to them. And he learned their names, and he learned jobs. So he got a friend of his to buy a disused bakery, and he created a thing called Homeboy Bakeries. He brought with him the chief executive of Homeboy Bakeries, who'd spent 26 years in jail, 16 of them on death row, now the chief executive of this organisation. And that was one of the things he said to me. Stand in awe at the burdens some people have to carry. Don't stand in judgment at the way they carry them. If only the Daily Mail would take that to heart. That's the whole thing. If you put yourself in their position, that's the first step to connecting with them. I'm always very conscious that when I talk about people taking control of their own lives, when I talk like this down in England, someone always says, so you're a supporter of the big society? And then I say, so I always put this up. No, I'm not a supporter of the big society. I was a medical student in 1971 when we elected Jimmy Reid rector of Glasgow University, and his rectorial address was reprinted in full in the New York Times, which described it as the single most important piece of public rhetoric since the Gettysburg Address. And those of us who were there actually thought that rather flattered Abraham Lincoln, to be perfectly honest. And that's what it was about. The cry of men who feel themselves the victim of blind economic forces beyond their control, the frustration of ordinary people excluded from the processes of decision-making, the feeling of despair and hopelessness that pervades people who feel they have no real say in shaping and determining their own destinies. Jimmy Reid saw that happening in the 1970s, and it's got worse. What we're seeing in places like Greece, they're going to go through what we've been going through for the past 3 decades. The cost of bailing out the banks will pale into insignificance against the cost that these societies will have to bear in terms of violence and ill health and so on. But we at least now have a good idea of what the answers are, and the answers are inclusion by whatever method. Make people part of a community again and give them a sense of pride, a sense of control. And that's what the third sector does superbly well. It's what the public sector, I sense, through health and social care integration, is learning to do, but at Every stage we've got to remind ourselves, don't do things to people, do things with people. Support them in their efforts to connect with each other, and the dividends will be huge. Thanks very much.